Okay, so welcome everybody to this YouTube video where I have Dr. Jeffrey Ruterbusch as a guest today. Welcome, Jeffrey.
Please like and subscribe. Thank you.
And hit that notification bell so you won't miss anything.
Well, thanks for having me.
It's a pleasure. So I know you have been a while in our closed and free Facebook group TRT and HOT. So we noticed that you are very knowledgeable and you help a lot of guys out. So I want to officially introduce you today. So tell us a bit about yourself, what you had as education, and maybe a bit about your career.
All right. How do I summarize 64 years? Well, all right. So I'm a retired Navy physician where I spent 30 years practicing sports medicine. And I retired, 7-8 years ago. And I went to Kuwait and I practiced medicine there for a while. And I came back and I opened up a clinic here. I'm currently the medical director of a men's sexual health clinic. I work for a larger corporation, and I'm the medical director of the clinic Men's Health Plus, as it's currently called, in Jacksonville, Florida. My wife and I currently do own together a wellness studio. It's called Kick Some Mass, where we do primarily weight loss, nutritional therapies, one-on-one counseling. My wife's a personal trainer, and so am I, although I don't do that as a physician. But I do have an advanced degree in exercise and sports science, one of my several master's degrees. But yeah, back to my Navy career. I came in as a line officer. I went to the Medical Service Corps as a flight physiologist and worked with a lot of pilots in the NASA aeronautical space program. So I gravitated naturally with a master in exercise and sports science into the health promotion and wellness realm, because I really feel that exercise and lifestyle choices, appropriate ones, are indeed the best source of wellness, health promotion. So I did the only sports and exercise preventive medicine program in the United States. It was a combined program at the University of California in San Diego and San Diego State University, where I was able to do a lot of great clinical rotations with the Padres and the Aztecs and the Chargers and the Olympic Training Center. I got to do a rotation with the Detroit Lions and some rotations with the sports medicine and rehabilitation treatment centers that the Navy owns and operates. Upon completion of that program, I did become a sports med doc, and I was sent to Mayport, Florida, which is Jacksonville area, where I stood up and opened up the first sports med center the Navy has in Florida. And then I said that I retired. But let me go back a little bit as to how long I've been in this game. My father was a drug rep for SEBA back in the 60s. Now, obviously, I was in elementary school. However, I recall my father's medicine cabinet being routinely raided for 2 drugs, Ritalin and Dianabol, because his company, SEBA, carried those 2 drugs back in the day. So that's why I was first introduced to this Dianabol substance, which at the time, people don't remember this, but the scientific community said didn't work. It had no credibility. You know, they didn't support it as far as performance enhancing drugs. Well, anyhow, so I was introduced to Dianabol years ago because my father had that as a drug. And then, of course, I was educated through college and graduate school and medical school, where I was introduced to the usual disease and sickness care paradigms. that many of my physician friends will, can associate with. But I always thought this is not why I went into medicine, to take care of people that are ill because they made so many poor lifestyle choices.
Mm-hmm.
And if you know anything about American medicine, we comprise about 5 or 6% of the global population. We consume 80% of the pain pills internationally, and we consume a lot more medications. Pretty much most any other country I've been to. And with my 30-year Navy career, I've been able to see every continent and actually live on and practice medicine in 5 of those continents. So that gave me great insight as to the cultural diversity and how other physicians in other nations practice medicine. I learned a lot when dealing with the strongmen in the Scandinavian countries, especially when I was stationed in Iceland.
Mm-hmm.
I learned a lot stationed in Okinawa, Japan, where the Japanese look upon things totally differently when it comes to how they take care of themselves. So I saw a big disparity globally. So, but my first and foremost love is obviously fitness. I mean, I've been weight training every day since I was 14. I currently have a 5,000 square foot facility here called Kick Some Ass, where we have lots of hundreds of thousands of dollars invested in equipment here. My wife and I do. So, like I say, I've been exposed to steroids, anabolics since the 60s. As an athlete, I mean, I have to admit, Steve and I, at one time in my career, I was a 15-year consumer of heavier doses of anabolics like testosterone
Mm-hmm.
and decadurabolin and anadrol. I gained, probably 40 to 50 pounds in lean body mass in a matter of a few months.
We
So
must
I
see those
became
pics.
so,
We must see those pics.
yeah. So I know how it works, and I got tired of people saying, "Oh, it doesn't work. It's not scientifically proven." But anyhow, my first in love is obviously dealing with this type of industry and taking care of men and a few women, but mostly my specialty is men, where I currently do things like TOT, testosterone optimization therapy. We work on erectile dysfunction issues, premature ejaculation issues. We do acoustic wave therapies on the penis to break up plaque and create angiogenesis or neovascularization. We do injections of, bimixes and trimixes and quad mixes and quint mixes for guys that have bad ED that need to do that. We do P shots, which is, PRP,
Mm-hmm.
injections into the penis. I'm trying to move into the MSC exosome realm of intracorporeal injections. I learned about that last month in Miami. I attended the AMMG conference. No, by the way, I'm board certified in both sports medicine and anti-aging medicine through the age management medicine group. I was one of the first of only 3 physicians back in 2011 that took and successfully passed the first prototypical AMMG board exam. So I'm proud of it. I was one of 3. But like I say, I've been in this field a long time, both on the side of being a heavy user, and now as I'm older and I see the benefits of physiologically dosing versus supraphysiological dosing, and I've seen what it did to me. Oh, by the way, I'm mid-60s. I had the blood work of a healthy 25-year-old. Yet in my family, cardiac disease runs rampant. My dad dropped dead. My twin brother had a valve replaced. It runs in my family to have this cardiovascular disease. Yet when I get worked up by my docs, they say I have the blood work and the vessels of a healthy 25-year-old, and they say, "What's your secret?" Now, when I was in the Navy, I couldn't tell them. Well, I've been on testosterone for almost 30 years. Now that I'm out, I tell people I've been on testosterone for almost 30 years. And, I tell patients, say, Doc, aren't you worried it's going to kill you? I said, no, do I look dead to you? My point is, they said, but there's a downside. I said, there's a downside also to not optimizing your testosterone. You have to weigh the risks and benefit ratios. And no, so I've gone to the A4M meetings. I've gone to the AMMG meetings. I've rubbed elbows with some of the best who I deeply respect, like Neil Rozier. I got to know Rob Coleman-Eric very well. I rubbed elbows for the first time with Jay Campbell when I was in Miami, and I respect what he's done. I think his books are phenomenal. I would highly recommend them. So that's just a quick nutshell of where I am and why I am where I am. Because again, I've been an athlete, I've been an abuser, so to speak, and now as a physician, I simply must promote physiological doses. And you think about it, Stephen, what better medicine for longevity, for health promotion and wellness than than testosterone, the hormone of youth and vitality and vigor. So here I am to hopefully share some of my over 40 years of being exposed to it, 30 years of being a user, and 17 years now of being a prescriber of testosterone therapies.
Yeah, you're a world of knowledge for sure. So a lot of men can learn from you. So that's why I invite you to join our TOT Doctors Roundtable together with the other doctors we already had on previously. So that will be interesting for you too to meet the other guys.
Yes, I know. I met a lot of those people, and I do think highly of everybody you have on that roundtable, and I'm proud to be an active member.
Yeah, it's especially Dr. Keith Nichols that you know for sure.
Yes,
Yeah.
I know him. He's very well knowledge, and so is his wife.
She is. She's helping me out with the podcast on female hormones. So
yes.
Yeah. Okay, so thank you so much for this extensive introduction to your own career and experience and this TOT. And I invite you to join our next TOT Doctors Roundtable that is coming up very soon.
Yes, I think you said it was Saturday, June the 1st.
Yes, let me have a look in our calendar. That's exactly right. Saturday,
at
June the 1st.
3 p.m. Eastern Standard Time.
Exactly.
Yeah.
So we'll see you there probably and hopefully with Dr. Eric Serrano.
Yes, I'm well aware of his knowledge base too. I've heard him speak on these podcasts, so more than happy to join him, and hopefully it'd be a win-win-win situation.
Okay, I already had a lot of questions coming in, and for the viewers, if you have any more, just send them through in our Facebook group. So thank you very much, and talk to you later, Dr. Jeffrey Ruterbusch,
Thanks, Stephen. You have a good day also.
Okay, thank you so much.